Welcome to the Deep Dive. Today, we're tackling a really important topic if you're revising pediatrics, maybe for the MSRA. Inhaled foreign bodies in children.
That's right.
And we're using the revision notes you sent us. So our goal here is simple. Pull out the absolute must-know, high-yield stuff from these notes fast.
Exactly. Taking your structure and finding those clinical gems, it's surprisingly common, actually, and can be very serious. So knowing this stuff from the notes is vital. Let's get into it.
Okay, first things first. The definition. Your notes keep it simple, right? Just an object accidentally breathed in.
Yeah, breathed into the airway, often ending up lower down, maybe the lungs. And the big issue, the immediate problem, is blockage. Obstruction.
Obstruction leading to breathing problems. Makes sense.
That's the core of it, an unexpected block.
So the crucial revision question,
Yeah.
Who gets this and why? What do your notes say about etiology, the risk factors?
The notes are very, very clear on this. The highest risk group, young children.
Right.
Specifically under the age of 3. That's the key demographic mentioned.
Under 3. Okay, that tracks. And the reasons given in the notes. Why them?
Well, it's really down to their development and, behavior. The notes talk about those exploratory behaviors.
The everything in the mouth stage.
Exactly that stage. Combine that with not being great at chewing yet, maybe eating too fast, or playing while eating. And playing with small things. Your notes list food bits, obviously, but also small toys, coins, all flagged as major risks.
And supervision comes into it, too.
Definitely. Inadequate supervision during eating or playing is mentioned as a significant factor in the notes.
Okay, so the epidemiology flows straight from that then. Your notes link it back to being common under 3 because of that oral exploration.
Spot on. While the notes don't give like a precise UK statistic, they really emphasize it's a significant pediatric emergency physicians need to be aware of.
A known and important cause of respiratory distress. Got it.
Yeah.
So the object's in. What's actually happening pathologically speaking? What do the notes describe?
Okay, so inside the airway, the object can cause a blockage, either partial or complete. That's what causes the immediate obstruction symptoms.
Right.
But also just having something foreign there irritates the lining, so you get inflammation. And if it stays there...
Infection risk.
Yeah, infection and potentially actual tissue damage over time. That's laid out in the notes.
Okay, that explains why getting it out quickly is so important. So what does it look like clinically? What are the key features from your notes we should remember for exams?
The absolute hallmark sign your notes stress is the sudden onset.
Sudden. Okay.
Yeah, a child seems perfectly fine one moment, maybe eating or playing, and then bam, sudden choking or really intense coughing fit. That sharp change is a massive red flag according to the notes.
That suddenness is key for thinking about it. Are there other symptoms listed if maybe it wasn't a dramatic choke or it wasn't coughed out immediately?
Yes, the notes list other things to watch for. Wheezing, or maybe stridor, that noisy breathing sound, difficulty breathing, the medical term being dyspnea, and sometimes vomiting can happen too.
And it can vary depending on where it's stuck.
Exactly. The notes point out that the specific symptoms depend quite a bit on the location in the airway. And though less common right at the start, your notes mention that in severe or maybe missed cases, you could even see hemoptysis, coughing up blood.
Right, so it's not always the classic Hollywood choke. Could be a persistent cough or wheeze that maybe gets mistaken for something else initially.
Precisely.
Speaking of mistakes, what about differential diagnoses? What else does your notes list that might present similarly?
The list in your notes is quite concise, actually. It includes things like respiratory infections, perhaps general airway inflammation like in asthma or croup, sometimes, though much rarer, airway tumors, or even underlying congenital issues with the airway structure.
Okay, useful list to keep in mind. So how do we confirm it? And crucially, how is it managed? What investigations and management strategies are highlighted in your notes?
For investigations, imaging like a chest X-ray, maybe a CT, can sometimes help. They might show the object, especially if it's, dense enough to see on X-ray.
Radiopaque.
Yeah, but your notes really, really emphasize the critical point, the absolute gold standard, and that's a key term from the notes for both diagnosis and removal is bronchoscopy.
Bronchoscopy.
Yeah.
That feels like the big take-home point for revision, doesn't it? See it and treat it in one go.
Absolutely. According to your notes, bronchoscopic removal is the standard approach here in the UK. The absolute key is prompt removal. Get it out.
Prevent those complications.
Exactly. While bronchoscopy is the go-to, the notes do mention that occasionally surgery might be needed if it's a really complex situation. And of course, supportive care, managing breathing is important too.
Okay, prompt removal. So what's the outlook usually? The prognosis, what do the notes say?
Generally favorable. If, and it's a big if emphasized in the notes, it's diagnosed and removed promptly. Time is really critical.
And the flip side, the risks if there's a delay, according to the notes.
Yeah, the notes list some serious complications if treatment is delayed or missed. Infections are a big one. Pneumonia, even a lung abscess. Atelectasis, which is lung collapse. Pneumothorax is possible. And potentially long-term scarring or chronic respiratory problems.
Wow.
And the notes are clear. Severe cases, unfortunately, can be life-threatening.
Gosh. Starts with maybe just a peanut or a small toy part. That really underlines why this is such a high-yield topic.
It really does.
Yeah.
So for your revision, just like your notes structure it, focus on the who, those under threes, the risk factors, then the what, that sudden onset, the variable symptoms, and definitely the how. Remember bronchoscopy, gold standard for finding it and getting it out. That structure from your notes really helps lock it in.
That's a great summary.
And just thinking about it, based on your notes, it's quite striking, isn't it? How incredibly common that exploratory phase is in toddlers, how many tiny objects are just lost around. This topic really sits at that sharp intersection where everyday childhood meets potential emergency medicine.
Wow.
Suddenly.
That is a really potent thought. Thank you so much for walking us through your notes like this. It's incredibly helpful.
Oh, you're very welcome. Keep working with these notes. Keep exploring these PANEDS topics for your revision. It really pays off.
Absolutely. And for everyone listening who's revising for the MSRA, don't forget PassTheMSRA.com has full revision courses, mock exams, the lot.
Mm-hmm.
And you can also find loads of great free MSRA revision materials over at freemsra.com.
Definitely check those out. All the very best with the revision.
Thanks for tuning in. We'll catch you on the next deep dive.